This is Barry Belosis, one of the musculoskeletal radiology fellows at Stanford University. 14-year-old female with worsening chronic recurrent left midfoot pain after an acute injury during a high school volleyball. Concern for Lisfranc injury. When examining the tarsal-metatarsal joint, we want to look at the alignment of the metatarsal in relation to the tarsal bone, such as the first metatarsal to the medial cuneiform on the AP view, and on the oblique view we can best assess the alignment of the third metatarsal and the lateral cuneiform. About 20 to 40% are missed on x-rays because some can be subtle. Weight-bearing views can be helpful if tolerated. Stress views or exam under anesthesia could be useful. There are signs that could suggest the presence of Lisfranc injury, including tarsal-metatarsal joint subluxation, flex sign, metatarsal neck fracture, compression fracture of cuboid, and diastasis of the medial and middle cuneiforms. Flex sign is an osseous fragment at the first intermetatarsal space, representing an avulsion fracture of the Lisfranc ligament. This should not be confused with a normal variant os intermetatarsium, which is an accessory ossicle projecting at the first intermetatarsal space, which could be seen on the dorsal aspect of the TMT joint on lateral view. On a different patient, 28-year-old athlete with midfoot pain, on this non-weight-bearing radiograph, we can see a subtle widening of the first intermetatarsal space, not so much on the oblique view, but on the lateral view, we could see some soft tissue swelling at the dorsum of the foot. Comparing this to a weight-bearing radiograph, we can see that there is increased widening on the weight-bearing radiograph and incongruency of the second metatarsal and middle cuneiform, which is more obvious than the non-weight-bearing radiograph. On our oblique view, we can see that the third metatarsal space and the lateral cuneiform is malaligned, which is very difficult to appreciate on the non-weight-bearing view. CT can be used to detect for fractures, assess for alignment and diastasis, and can be used for pre-op planning. We can see this 3D imaging showing dorsal subluxation of the metatarsals in relation to the cuneiforms, also seen here on our sagittal imaging. The coronal shows malalignment of the first and second TMT joint and also the third TMT joint. When there is persistent concern for Lisfranc injury in the presence of normal radiograph, MRI without contrast can be performed to assess for Lisfranc ligament complex injury. We look at the dorsal ligament, the interosseous ligament, which is the Lisfranc ligament proper, and the plantar ligament. We use all sequences and planes to assess for these ligaments. The dorsal band, however, could be best assessed on your axial imaging, such as in this axial T2 fat set showing this hypointense band from the medial cuneiform to the base of the second metatarsal. The interosseous ligament can also be seen on the axial imaging or coronal imaging. The plantar ligament could be seen in axial and the coronal, and it sends from the medial cuneiform to the base of the second metatarsal, an additional band to the third metatarsal base. Here in our coronal T1 imaging, we can see the two bands arising from the medial cuneiform. This is in a different patient showing a high-grade tear of the dorsal band as demonstrated by this defect at the proximal attachment of the dorsal band. We do not see the continuity of this band to the medial cuneiform compared to the normal band that we saw. The same patient also have a low-grade sprain of the interosseous ligament, showing increased signal here of the interosseous ligament in our axial T2 fat set. In our coronal T2 fat set imaging, we can see the band from the medial cuneiform to the base of the second metatarsal, and our coronal T1 imaging also demonstrates this increased signal of the interosseous ligament.